Hi, I'm Heidi Galarza Argudo, and today's topic is respiratory syncytial virus and recurrent wheeze in healthy preterm infants. So, definition: illness of the lower respiratory tract, like a wheeze that is caused by RSV, is the most common cause of hospital admission in the winter season during the first year of life.
Little babies who wheeze very young get a disease called RSV, and they wheeze afterward. Does that mean they're going to be an asthmatic, or did the infection RSV is making them wheeze? What's that story about?
RSV is one of the most common viruses that children are infected with. In fact, within the first 2 years of life, virtually every child has been infected by this virus at least once. Most children who get RSV infection get nothing more than a runny nose, mild cough, which goes away in 5 to 7 days. But about 25 to 30% of these children will go on to develop wheezing and difficulty breathing, and some of these children actually end up in the hospital to care for these episodes. What we've learned is that the children who wheeze from their RSV infection do have a higher risk of developing asthma as they get older, but it is not a 100% risk. And so what we tell parents is that if children are wheezing from their RSV, then we need to monitor them closely over the next several years so that if asthma develops, we can treat it promptly, minimizing future problems.
If a certain group you heard about got it, what group would that be the most risky group? Is that big babies, little babies? What group is that?
Well, certainly there are children who have greater risks of having serious problems when they develop RSV infection. And we've characterized those children into certain groups. The groups that are at the greatest risk are babies who had been born prematurely. Babies born prematurely have lungs which are either not fully developed at birth or have lung development after birth which is slightly different than a full-term baby. This difference in lung development makes these children at significantly greater risk for having wheezing and more serious problems when they get their RSV infection.
These tiny prematures, like maybe 30, 32 weeks, really at high risk. Is there anything we can do so they don't get so sick?
Certainly. There are a number of different strategies that we use. The first, of course, is to try to minimize the risk of getting that infection at the earliest age. So we want minimal exposure to other children who may be carriers of the virus. We want to make sure that anybody who touches or handles these children wash their hands properly and are otherwise not sick. Once we take these usual precautions to minimize exposure, the next thing we do is to immunize these patients with a new vaccine which prevents the serious form of the RSV infection. This vaccine is called syncytial and is required to be given once a month throughout the high-risk time of year. That is from October through March in the East Coast. In other areas of the country, the risky time of year may be slightly different, but generally we give this vaccination once a month for a 5 to 6 month period during this high-risk period to minimize the seriousness of RSV infection if the premature infants contract it.
When you say premature, how premature does the child have to be considered to get this vaccine?
Any premature child can be considered for this vaccine, and then there are various risk factors which we factor in to decide which child actually gets it or not. But the starting point is always prematurity all by itself. The more premature the child is, the greater their risk, and so the greater likelihood is that they would qualify. Children that are near term, 34 to 36 weeks, would need several other risk factors before they would be required to get the RSV syncytial vaccination.
So, application in medicine. Severe RSV bronchiolitis has been associated with an increase in subsequent rates of early wheezing, asthma, and possibility allergic sensitization later in life.
RSV. Uh, Kids who get it somehow seem to be more like having asthma attacks or wheezing attacks after we're over. Is that possible?
RSV, respiratory syncytial virus, is a virus that causes a condition known as bronchiolitis in children under the age of 2. Bronchiolitis is a condition where the child is wheezing and has difficulty breathing for a period of 7 to 10 days. What we know is that the RSV virus does cause some damage to the lining of the lung, and that lining can take many months to fully heal. During that period, the patient is certainly susceptible to have repeated episodes of wheezing with any other viral infection that may occur. What we're also seeing is that these children who've had wheezing with their RSV infection do have an increased risk to have repeated periods of wheezing even out until they're 5, 6, or 7 years of age. Sometimes these children are diagnosed as asthma, when in fact it's the result of the RSV infection, and after they reach that point, somewhere between 5 and 7, they outgrow their wheezing disease. Once you diagnose the infection clinically, doing the nasal smear test to prove that it's RSV helps to identify the cause of that episode of bronchiolitis, since other viruses can cause bronchiolitis as well. Knowing that it was RSV infection certainly allows us to be prepared for these repeated wheezing episodes that can occur with RSV infection specifically. Once this nasal smear test is done once, however, and is proven to be positive, there's really no need to repeat the test. The patient will recover from the infection within a 7 to 10 day period, and repeating the test would not help us plan treatment or predict outcomes.
Pros and cons. Pros. The treatment reduces the number of parent-reported wheezing days during the first year of life, even after the end of the therapy. And cons. RSV infection in early life eventually led to long-term remodeling of the pulmonary system and hyper-responsiveness to respiratory viruses and non-specific stimuli. Disease. Respiratory syncytial virus, which causes infection of the lungs and breathing passages, is a major cause of respiratory illness in young children. But how does the virus attack the cells? Let's see this video.
RSV bronchiolitis is a serious threat to the health of infants and young children. Based on historical estimates, it is the leading cause of infant hospitalization as well as the leading cause of infant viral death. RSV lower respiratory tract infections lead to epithelial necrosis, with the loss of ciliated cells, smooth muscle constriction of the airways, goblet cell proliferation with increased mucus production, and parabronchiolar inflammation and edema. As a result, pulmonary function during RSV lower respiratory tract infections may be significantly compromised, leading to difficulty breathing and decrease systemic oxygenation.
Symptoms. In premature children and kids, the disease affects the lungs, heart, or immune system, so it's more serious. And in adults, the symptoms are common cold, such as stuffy or runny nose, sore throat, mild headache, cough, fever, a general feeling of feeling ill.
Today in Good Growing, we're talking about a virus that every parent should know about because it is highly contagious. It is called Respiratory Syncytial Virus, or RSV. That's how most parents know it, RSV. Dr. Richard Multaney from Children's Hospital and Regional Medical Center is here to tell us how this virus can wreak havoc. What is RSV, first of all?
First of all, you said that perfectly. That's
Thank
a hard
you,
word.
syncytial virus.
It is a virus that infects primarily very young children. By the age of 2, most children have been exposed and have developed immunity. In the very youngest of children, though, it is the commonest cause for hospitalization for respiratory diseases, and it produces wheezing, asthma, and pneumonia symptoms in young children.
So how are those symptoms, or how would a parent know that it's different from just an everyday cold?
It'll start the same way. The child will be irritable, not eat well, have a low-grade fever, have a cough, and runny nose, sort of normal cold symptoms. But then when it progresses to a child having more rapid respiratory rate, when there's difficulty with breathing, you'll see the chest
Sometimes
retracting.
people say my heart hurts or my chest hurts.
Chest can hurt. And the worst, of course, is if the child stops drinking and eating, a young child, because then dehydration sets in. So it's cold symptoms that just don't seem to go away and then lead to poor sleeping, poor eating, and a very cranky, irritable child.
How common is it?
Well, you could say 12 children out of 100 each year are actually going to, under a year of age, are going to require hospitalization.
12 out of 100 under the age of 1. Hospitalization.
Hospitalization, not just a cold. But I would tell you that of that children under 1 year of age, about half of them will be exposed to this virus in the first year, and almost the second half will be exposed in the second year. So within 2 years, we've seen this bug.
Okay, let's talk about how kids might be at risk.
The kids that are going to be most at risk, not just from acquisition of the infection, but of a serious infection leading to hospitalization, are first of all the younger you are.
So attending daycare.
Now, how do you get it? You bet. Attending daycare, particularly daycare settings in which there are more than 6 children.
Okay.
If you're unfortunate enough to have a sibling who's in daycare, they're going to bring it back home to you. Smoking in the home or in a car, even wood-burning stoves increase the risk.
Really?
And children with premature disease are often left with sort of weak lungs, and they're more likely to pick up those infections, as are children with immune deficiencies, cancers, heart disease.
Is it avoidable?
It's avoidable only in the very highest risk kids. We can give shots every month to children who are at high risk. It's not pleasant, but they can get that and avoid it. But for you and I, on the average child, the only way to avoid it is avoid crowds, avoid children who you know are really infected with the virus. And then the good measures we can teach kids. The new cough into your sleeve, not on
out
your
into the
hands,
open
not
air,
into the
here
open
when
air.
you touch things.
Exactly.
So it's spread just like a cold.
It is. It's in the air, but it's also on the surfaces you touch.
Okay.
So we have to teach kids to wash hands, and parents, after they handle the child or handle secretions or in toys or other things that will carry this infection.
Dr. Multaney, thanks so much.
It's always a pleasure.
Learn
Thank
more
you,
today
Joyce.
about RSV. You can find out more information about this on our website as well. Just go to king5.com. Thank you.
So RSV can spread rapidly through schools and childcare centers, so it's better to prevent it. Prevention can be frequent hand washing or a monthly injection of a medication consisting of RSV antibodies during the peak RSV season, which is through November to April.
Welcome to Memorial Health and You. Ever heard of respiratory syncytial virus? It's found everywhere and it's potentially deadly, especially for infants. Today we're speaking with Dr. Katie Eisenhuth, Memorial Pediatrician. Why is RSV so dangerous, Dr. Katie?
RSV is so common, most children will have it before the age of 3. It causes lung infections, inflammation in the airways, and a lot of mucus. It's no worse than the common cold in older children and healthy adults. But infants may develop significant RSV infection in their lungs called bronchiolitis. In infants, airways are already small. The mucus and sloughed off respiratory cells clog these tiny airways so that even less air can move through. We worry most about very young or premature infants and babies with other health conditions. Babies with RSV bronchiolitis sometimes breathe so fast they have trouble eating and become dehydrated. You may see the nostrils flare out with each inhalation and indentations in the chest as they work hard to breathe. These are signs that your baby should be seen by a medical professional immediately. Antibiotics are not helpful because RSV is a viral infection.
Are there any precautions we can take?
The virus can enter through the eyes, nose, or mouth. It spreads with coughing, sneezing, or with contact, such as shaking hands. Children in child care centers or with siblings in school are at higher risk, as are infants exposed to air pollution or cigarette smoke. Wash your hands, cover your mouth when you sneeze or cough. Keep countertops clean and wash toys regularly. Don't share drinking glasses, and most importantly, don't smoke. These precautions can help protect your baby from getting serious RSV.
Thank you, Dr. Katie. If you'd like us to send you more information about RSV, call us right now at 228-868-6500 or visit www.gulfportmemorial.com. Call 867-5000 if you'd like to make an appointment.
So thank you very much for your attention.